и добре дошли в моя YouTube канал. Днес ще ви срещна с доктор Енрике Гевара от Лима, Перу. Това е човекът, който със собствени усилия и средства успява да построи най-големия център по фетална медицина и хирургия в Латинска Америка. И ако за мен той е просто Енрике Гевара, то за колегите си в Латинска Америка той е професор Енрике Гевара, най-големия специалист по фетална медицина и фетална хирургия. Уважението, което изпитват към него неговите колеги, не може да бъде описано с думи. Трябва просто да си живее. За да спечели доверието и уважението на своите пациенти, един лекар има нужда от добър пиар, малко харизма и успешно лечение в 90% от случаите. За да спечелиш уважението на колегите си обаче, ти трябва много повече от това. Надявам се енергията и ентусиазмът, с които Енрике говори, да ви зарази и вас. Приятно гледане! Enrique, it's a great honor and pleasure to have you in my channel.
Thank you, Slaviana. Thank you very much. The pleasure is mine.
So tell us more about what you do and how you have developed your unit in the country.
The concept of fetal medicine is based that we treat the human being as a patient from inside the womb of the mother. So from that starting point, we consider prenatal diagnosis like the cornerstone of everything. Once you have prenatal diagnosis, you can decide if this patient, that is the fetus, is suitable of having any fetal therapy. That can be medical or can be surgical. So if we understand that concept, then when I went back to Peru after being 3 years in London with Professor Nicolaides and 1 year in United States with Dr. Perot in Cincinnati, I decided that if I want to dedicate to fetal medicine, I need to enhance and reinforce prenatal diagnosis. So that's essentially what I did. As an obstetrician and gynecologist that is super specialized in this field, I consider that training of new obstetricians is basic, because not all the cases are gonna come for you. You are gonna be referred by other doctors. But how you get those referrals if those doctors are not getting specialized in doing prenatal diagnosis? So for me, it's not about a fancy thing of saying, yes, we do fetal therapy. The real tricky and the hardest thing is to do prenatal diagnosis. It may seem easy to do prenatal diagnosis, but it's not, because identifying images in an ultrasound machine needs to go together with counseling. Because at the end of the day, parents are the ones that are going to decide if they are going to do the surgery or not, or they are going to follow a treatment, a medical treatment or not. So based on that, one of the things that I did when I started in Peru is to expand this concept of the fetus as a patient, one, of the necessity of work together with other obstetricians in the management of the pregnant woman. Because we have two patients, the mother and the baby. So we need to work as a team. Based on that, those doctors that are now aware of the importance of fetal medicine are the ones that tell the patients, you need to do your ultrasound at 12 weeks, your ultrasound at 22, and your ultrasound at 36. And according to that, they send those patients to the fetal medicine specialists. So that's the way now that we are starting to do in Peru. They are sending the patients, and during those routine scans, if we identify something that is abnormal, that may be treated or not, that may be something mild or severe, that's something that we as specialists, we decide what it is, we diagnose, and then we tell the patients. Once we do the counseling, the patients are the ones that are going to decide, and then together with the obstetrician, we do the final management.
So far, how many fellows have you trained?
So far, I am right now in the 4th edition. The first edition I trained 35, the second 35, the third one 42, and now I have 42 more. So they are all from the capital, from Lima in Peru,
Yes.
and also from the countryside.
Yes.
So I remember I have a very good friend from mine, from Romania, Lucian Pop, that asked me, how many procedures do you do per year?
Yes.
Yeah, but it's not a steady number. Because thanks to what I'm telling you, the number is getting increased because those doctors that are now becoming like a referral in their cities, they are the ones sending the patients. And that's
Yes.
why I can increase the number and everything. But we need to understand that the main goal of all this is to move the concept that the health does not start with the birth, it starts from the conception. And even more, if you want to go further, you can say that it starts even before conception. So that's the importance of giving those 9 months inside the womb the relevance that it must have.
I was very impressed also that you do all the procedures free of charge for your patients.
Yes, so the other thing that I was, as I told you, talking with my friend Lucian, is that he asked me if I was working specifically in a public hospital. And in Peru, when you work in a public hospital, you need to understand that if you want to do fetal medicine of quality, of excellence, you need to have a good ultrasound machines. So unfortunately, in a public hospital, it's like very difficult to get this. So we created the Institute of Fetal Medicine, which has a good technology. But then, how do you get to those patients that cannot afford to pay privately ultrasound? That's one thing. And the other thing is, when you want to book an appointment in Peru, I don't know how it's in other countries, but at least in Peru, you take 3 months because of the bureaucracy. So they say, yeah, doctors don't scan. In Peru, doctors are very skilled, very talented. But they don't see the patients because when they book, there is so much bureaucracy that if the patient is 10 weeks, they book it for 16 weeks. So you miss the opportunity of having the nuchal scan. Understand what I'm
Yes,
saying?
I understand.
So the doctor is very good, yeah, but if you put appointments every 15 minutes, you're gonna tire him or tire her out. You're gonna make him tired. In Peru, if you have a very good doctor and you give it a machine that cannot even work, or the buttons don't work or whatever, he's not gonna put, and they say no, the quality of scans, you may say, is bad, but it's not because of the skills of the doctors. It's because the system, the public system, that it works. So, to fight this, I decided to create a foundation. So through this foundation, I can gather money from my center and from other centers that want to help. So people that are with a diagnosis of any problem and do not have money to pay in a private center, I can treat them for free. So I can see them, I can treat them, and then at the end of the day, it's not like it's not about money, as I was telling you. It's about how you go in people's life. So that's my belief. That's the way I do.
Is this your message for the young doctors?
Exactly.
And the young generation?
The message is that what I see, especially in our field, is that, and I understand because when you are young, you are very enthusiastic and everything. You don't have to look for the fancy things. You need to look for the things that are gonna go beyond life, and those things you cultivate them progressively, not like immediately. Those are the fancy things that you get immediately, but the other ones you need to go slowly. And if you go slowly, people are gonna recognize your work. Consistently, and people are gonna recognize your work, and not only doctors but patients, which is the most important part. Yeah.
I think this was a great message from
Yeah.
you.
Yeah.
It was a great honor to have you in
Okay.
our channel.
Thank you.
And again, thank you.
Okay. Thank you. Bye bye.
Thank you.